You want to know how to manage lung transplant complications and multi-organ failure if you have a loved one critically ill in intensive care after lung transplant. Stay tuned, I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care. So today I have an email from Ajeva who says, "Hi Patrick, my mum is in ICU after lung transplant, and she's now facing lung transplant complications and multi-organ failure. What are the right steps to provide my mum with the best care and treatment?" So, well, first of all, Ajeva, thank you so much for reaching out and sharing your concerns about lung transplant and complications and multi-organ failure. This is indeed a very complex and challenging situation. As you've outlined, lung transplant recipients face numerous risks, both in the short and long term. The potential for complications and the possibility of multi-organ failure underscore the importance of specialized care and vigilant monitoring in intensive care. What we do here is we offer support and guidance for families in intensive care, navigating the complexities of intensive care. If you have a loved one facing these challenges, that's why you can reach out to us here at intensivecarehotline.com, where we provide you with advice, consulting, and advocacy. And that's why we're happy to help you how we can best support you and your family during this difficult time. So, lung transplants are complex procedures with significant risks. Complications can arise immediately after surgery or develop over time, sometimes leading to multi-organ failure. So let's do a quick overview about common lung transplant complications. Number one, primary graft dysfunction. Acute lung injury within the first 72 hours after transplants, often due to ischemia reperfusion injury. Acute rejection. The immune system attacks the transplanted lungs, leading to inflammation and decreased lung function. Chronic lung allograft dysfunction, progressive lung function decline, commonly presenting as bronchiolitis, obliterans syndrome. Next, infections. Due to immunosuppressive therapy after lung transplant recipients are highly susceptible to bacterial, viral, and fungal infections. Number 5, surgical complications, airway dehiscence, anastomotic strictures, bleeding, or pleural complications. And number 6, immunosuppressive drug toxicity. Long-term use of these drugs can lead to kidney damage, diabetes, and increased risk of cancer. Next, multi-organ failure after lung transplant. Multi-organ failure can occur due to severe complications affecting multiple systems. Number 1, respiratory failure from the primary graft dysfunction or chronic rejection. Number 2, renal or kidney failure caused by nephrotoxic immunosuppressants, i.e. calcineurin inhibitors or sepsis. Next, cardiovascular complications such as pulmonary hypertension, right heart failure, or arrhythmias, but also such as hypertension or hypotension due to pain or volume loss or sepsis. Liver dysfunction due to drug toxicity or infection. Neurological issues such as stroke, encephalopathy, or seizures from infections or metabolic imbalances. What are management and prognosis? Early detection of complications through regularly monitoring, optimized immunosuppression to balance rejection risk and infection prevention, aggressive infection control with prophylactic antibiotics, antifungals, and antivirals, supportive care in intensive care units for multi-organ dysfunction, including dialysis, ECMO, and ventilation support. Despite all the advances in transplant medicine, lung transplants remain high-risk procedures with lower long-term survival rates than other solid organ transplants. Have you encountered any other specific cases or concerns regarding this topic? While you're watching this, we want to hear from you as well. But in any case, when I worked in ICU and I looked after lung transplant patients, I've seen multiple complications. It is not straightforward. There have been few patients where, a lung transplant has been reasonably straightforward. Patients stayed in ICU for a couple of days, and then they went onto the ward and went on to rehabilitation. But I've seen many other patients where it wasn't straightforward. They often ended up on ECMO for a few days, you know, and then often also came back into ICU, unfortunately. It is unfortunately not a straightforward procedure, but some patients certainly can live a much better life after a lung transplant. So I hope that helps you answer your question, Ajeva. You know, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in critical care. And I've been consulting and advocating for families in intensive care here at intensivecarehotline.com since 2013. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that by our testimonial section or on our testimonial section at intensivecarehotline.com. And you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews verifying the work that we've done and how we have helped them save their loved ones' lives. And our advice here is absolutely life-changing, as documented on our testimonial section and on our intensivecarehotline.com podcast section. It is absolutely life-changing, because the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's what we're here for, to help you. And that's why I do one-on-one consulting and advocacy, so that you can join a growing number of clients and members that we have helped over the years. We have helped hundreds and hundreds of members and clients over the years to improve their lives instantly by making informed decisions, have peace of mind, control, power, and influence, making sure their loved ones get best care and treatment always. And I do one-on-one consulting over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And when I talk to doctors and when I talk to you and your families directly, I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you're a subscriber to my email newsletter at intensivecarehotline.com, or if you're a subscriber to my YouTube channel. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.